The clock on the wall of Trauma Bay 3 read 2:14 a.m. Maya Rennick moved through the room the way water moves through a narrow pipe. Quiet, purposeful, taking the exact shape of whatever space she was given. A drunk college student was on the first bed. His friends had dropped him at the door and driven away. His blood pressure was low, his words were gone, and his shoes were untied. Maya checked his drip line, 12 drops per minute, steady. She moved to the next bed. A woman in her 60s was having a sugar crisis. Her hands were shaking. Her daughter stood in the corner, crying into her phone. Maya adjusted the glucose drip, spoke 3 short sentences to the attending doctor, and moved again. The room was loud. Machines beeped. Someone called for a cart. Maya did not rush. She never rushed. Rushing was for people who hadn't already seen the worst a body could do. Her co-workers thought she was calm. They said things like, "Nothing rattles Maya," and "She's got ice in her veins." They meant it as a compliment. They were wrong about what it meant. She was not calm. She was occupied. There was a difference, and it lived in a very small space behind her eyes, where she kept things that had no place to go. One problem at a time. That was how she moved through a shift. One drip line, one chart, one patient at a time. It was not a philosophy. It was a method. Methods kept her standing. She was counting the steps from Bay 3 to the supply room, 16, always 16, when the front doors opened. Not slid open, not swung open. Opened the way doors open when 4 men come through them at once, and the room rearranges itself around them without anyone asking it to. She heard the change before she saw it. A different quality of noise. The kind of noise a room makes when something serious has walked in wearing regular clothes. 4 men. Civilian clothing. Jeans, jackets, plain boots. One of them was being supported by 2 of the others. His left side was wrong, not broken wrong, damaged wrong. The kind of damage that had been managed already, somewhere else, by someone who knew what they were doing, and had now run past its management window. The nurses at the front desk stood. The attending on duty turned. People began moving toward the group the way hospital staff always do. Organized, quick, professional. Maya was already at the gurney. She did not remember deciding to go there. Her hands were already gloved. She checked the man's pupils. She checked his pulse at the wrist. She looked at the injury through the jacket they had cut open for her, and she did not flinch, because she had learned in a different life, in a different uniform, that flinching cost seconds, and seconds had a price she had already paid once. "Someone get me a pressure reading," she said. Her voice was exactly what it always was, low, already 2 steps ahead. The tallest one was watching her. She felt it the way you feel a light behind you when your eyes are closed, a weight, an attention. She did not look up. She called out the vitals. She asked for the IV line. She kept her eyes on the work. Then he said it. 1 word. Ghost. Not a question. Not an accident. A word said the way you say the name of someone you thought you would never see again, but always half expected to. The saline bag was in her hand. She counted the drops. 12, 13, 14. The bay kept moving. Machines kept beeping. The attending said something she answered. Her mouth was working. Her hands were working. 14, 15, 16. The word sat in the room like something that did not belong there and could not be moved. She hung the bag. She called out a medication instruction. She moved to the next task. Her voice was the same. Her hands were the same. She was not the same, but no one in that room could have told you why. The tall one kept watching. His name was Callahan. She had not known his last name, once, because in the places they had been together, last names were not the first thing you needed. She had known his hands, the way he moved in a doorway, the sound of his breathing when things were going wrong. She had known his call sign. He had known hers. Ghost. She had earned it honestly. Not because she was invisible. She wasn't. Not really. But because she moved without announcing herself. Through rooms, through fields, through moments that other people remembered and she did not speak about. She had been the one who arrived after the loud part and fixed what the loud part had broken. 3 deployments, 7 years. A life lived in a vocabulary that most people did not have words for. And then she had left, quietly, the way she did everything. Signed the papers, returned the gear, drove away on a Tuesday morning, without telling anyone she was going. She had changed her number. She had moved twice. She had applied for her nursing license under her middle name, which was legal and ordinary, and sounded like nothing. She had become Maya Rennick, night shift ER nurse, Bethesda adjacent, unremarkable. She had not become her. She had put her in a box and sealed it, and placed it somewhere behind her sternum, where there was no anatomy. At 3:40 a.m., she was in the break room counting ceiling tiles when Callaghan walked in. He did not knock. Operators never knocked on rooms that weren't secured. Old habit. She did not tell him this was rude. She already knew it wasn't, in the language they both still spoke without speaking it. She did not ask how he found her. She knew the answer, and did not want to hear it said out loud. He sat down across from her. He did not look good. He looked the way people look when they have been carrying something for a long time, and the weight has changed the shape of their posture. He had new lines at the corners of his eyes. She counted them the way she counted drip rates, because counting was the only thing that kept the other part of her brain from doing what it wanted to do. He told her two names, Santos and Reyes. She added them to a list. The list was not written anywhere. It lived in the same place as everything else she kept, behind the sternum, no anatomy, no address. Santos had been funny in a way that was hard to explain. Reyes had carried a photograph of his daughter in his left breast pocket, and touched it before every operation, without knowing he was doing it. Maya knew, because she had watched. Watching was what she did. She stood up and poured 2 coffees. She handed one to Callaghan. He took it. They did not say anything for a moment. The break room hummed. Outside, the ER made its usual sounds. Then he told her why he was there. There was a man, a contractor, someone who had worked with their unit on the 3rd deployment. He had been brought in that same night, to a different hospital, 20 minutes away. He was going into surgery in 6 hours. The civilian surgical team had his imaging, his chart, his vitals. They were reading them correctly, technically. But there was something in the injury pattern that Callaghan's people recognized, and the civilian team did not have the background to recognize. It was not a question of skill, it was a question of context. A question of having been in the specific places that created the specific kind of damage he was carrying. Callaghan needed someone who had that context. He needed Ghost. Maya looked at her hands wrapped around the coffee mug. They were the same hands that had kept Santos alive for 40 minutes in a ditch outside a city she was not supposed to name. The same hands that had worked on 3 other men in 3 other places, while the loud part was still happening around her. The same hands that had signed nursing school enrollment forms, and folded laundry, and written ordinary grocery lists in ordinary ink. They were the same hands. That was the problem. She did not say yes right away. She sat with the coffee and the ceiling tiles and the sound of the break room for long enough to make the decision feel like a decision and not a reflex. Then she stood up and put her mug in the sink. "Send me the imaging," she said. He already had it on his phone. She reviewed the scans on a borrowed tablet in the supply closet, standing between boxes of latex gloves and sterile gauze. The injury was not standard. She saw it immediately, a specific compression pattern around the thoracic cavity that looked, to someone without field experience, like a secondary result of the main trauma. It was not secondary, it was primary. It was the thing that would cause the problem during surgery if the surgical team opened in the wrong order. She called the hospital. She asked for the attending surgeon by name. She explained what she saw. The surgeon was quiet for a moment, then asked how she knew this presentation. She said she had seen it before. He asked where. She said in the field. He did not ask which field. This was the gift of competence, she had learned. It silenced questions. People trusted hands that moved without hesitation. People trusted voices that named things correctly. She named things correctly. The surgeon listened. He adjusted the surgical approach. She scrubbed in. She did not think about what it meant that she was there. She did not think about Ghost or Maya, or the box behind her sternum, or the 7 years she had spent becoming someone who did not need to be in rooms like this anymore. She thought about the man on the table, and the specific thing his body was doing, and the order of operations that would keep him alive. The surgery took 4 hours and 11 minutes. The man lived. This was not heroic. It was not a triumph. It was just the right outcome. arrived at through the right work. Maya had learned, in the life before this one, not to feel proud of keeping someone alive. Pride was for things that cost you something in the choosing. She had not chosen this. She had simply done it, the way she always did things, without announcing herself, without waiting for permission, without leaving a name on the door. At 5:58 a.m., she was back in Trauma Bay 3. The shift had turned over. New faces, new charts. The morning light was starting to come through the high windows, thin and pale, the kind of light that made hospital floors look like they belonged to a different building. The drunk college student had been discharged. The woman with the sugar crisis was stable. There were 2 new patients she had not met yet. She picked up the first chart. Callahan was gone. His team was gone. The man they had brought in had been transferred to a different facility. Quietly, the way things involving those men were always handled quietly. There would be no paperwork with her name on it. There would be no follow-up call. This was how it worked in that world. You did the thing, and the thing closed behind you like water. She stood at the drip line of the new patient, an older man with a cardiac event who had come in at 5:30 and was now stable and sleeping. She counted the drops. 1 problem at a time. The words landed differently than they had 16 hours ago when her shift had started. The same words, the same voice in her head saying them, but the distance between the woman who had thought them at 2 a.m. and the woman thinking them now at 6 a.m. was not nothing. It was not a great distance. It was not some enormous transformation. But it was real. The way a small shift in a foundation is real. You cannot see it from the outside, but the building knows. She did not feel better. She did not feel worse. She did not feel settled or unsettled, healed or broken open. She felt what she always felt when the work was done, occupied. Her hands had something to do. Her eyes had something to follow. The next task was already visible. Santos, Reyes. 2 names she would carry without being asked to, and without putting down. Ghost. A word said in a trauma bay at 2:14 in the morning by a man with new lines at the corners of his eyes. Maya Rennick. Night shift. Trauma Bay 3. 16 steps to the supply room. She had not gone looking for that night. She had not wanted it, but she had been the right person in the right place, which was something she had learned to stop being surprised by. She was always the right person in the right place. That was not luck. That was what 7 years of a certain kind of life had made her. She hung the new bag. She called out the vitals. She moved to the next bed. 1 problem at a time.